Healthcare is changing, and Dr. Nancy RN is here for you. The topics are many, but each program stands on its own with 3 key action points for you to learn. Your guide to a healthier you in a changing world. Dr. Nancy RN.
Welcome to Dr. Nancy RN, Healthy You, Healthy Nation, Healthy World. I'm Nancy Valentine, PhD and registered nurse. And this show is dedicated to you, the healthcare consumer. And today we have a really fabulous guest who is a nurse at Mainline Health. Andy DeRoberts, who I will introduce in a moment, worked with me when I was at Mainline Health, and I can tell you that she is one of these people that you may not meet when you go to the hospital, but you're going to be very happy if you go to any of the Mainline Health hospitals knowing that Andy has got your safety in mind. The title of our show today is Patient Safety Engagement and Empowerment, what hospitals are doing to ensure your safety. Now, let me tell you a little bit about Andy and her background. Andy is very, very well trained for the job that she has. She got her nursing degree at Villanova University School of Nursing. She has a master's in Health Services Administration from St. Francis University in Illinois. And she recently got her Six Sigma Black Belt, which she will explain to you in the course of conversation what that means, from Rutgers University. But that is a new certification that a lot of nurses and healthcare professionals are getting in order to make improvements in hospital operations, which is part of her job. Now, our focus today is around preventing medical errors in the hospital. And I just want to start out our show before I turn it over to Andy. About why this is such an important issue and why you need to be aware of it. Most people don't realize this, but medical errors are the leading cause of death or injury to inpatients and account for an estimated 44 to 98,000 deaths every year in U.S. hospitals. That's a lot of injury. The Institute of Medicine studied this and put several books out a number of years ago, and that really began this whole search for how to remedy this. The Agency for Healthcare Research and Quality, referred to as AHRQ, found that more people die from medical errors than from motor vehicle accidents, breast cancer, or AIDS. So that really puts it in amazing profile in terms of why we all need to be concerned about this. You would say, you know, I wasn't even aware of that. Well, that's true. The kind of hospital injuries that make headlines are usually high drama ones, such as a wrong arm or wrong leg being removed, or a surgical instrument left inside someone's body. But while much less dramatic, those small day-to-day things that occur in hospitals really add up. The number one cause of injury are falls, and falls can be lethal in a hospital. And closely following are medication errors. So Andy is going to help us understand how hospitals, Mainline Health, and hospitals across the United States are really going to tackle this problem. So Andy, thank you for being with us. It's a joy and a pleasure to see you and to be a guest on our show today. So, you know, I would like to just say that most people come into a hospital, they're thinking they are in a safe place. So you as a nurse, how did you get involved with this kind of work, and what is your passion about it? I know we're going to talk about falls and medication errors, but tell us your story about how you got involved.
Okay. Well, first of all, Nancy, thank you for having me. It is a pleasure to work with you once again. Just through my course of work at Mainline Health, I've done several roles. So I've been a staff nurse, I've been an educator, and all of these roles require some work with quality and patient safety. And I became very passionate when I saw that we, as in all these roles, could actually help the patient and make a difference. Mm-hmm. And as I went through my career, I was able to, as you said, further my education and gain the skills and knowledge to do this, and also just being a nurse, you just want to keep your patients safe. Mm-hmm. And in today's healthcare, we want to, all hospitals strive to become a high reliable organization, or we want to be the best organization possible and, keep our patients as safe as possible. So that's my background, and that's how I became to be very passionate about these types of things. Mm-hmm. So I currently lead several committees in terms of patient safety. So when Nancy mentioned falls is one of our major safety initiatives in keeping our patients safe. And one of the things we do to keep our patients safe is we use a lot of data within our health systems. We collect a lot of data, and we use that data to look at how we can improve our processes to keep our patients safe. And it's a continuous effort. We're always looking at how do we standardize our processes within our hospitals and across our systems. Through my black belt, one of the things I've learned is that the more standardized we can keep our processes, the less variety we have in our practices, the less errors there are, therefore keeping our patients safe.
Can you just stop and tell us about that black belt? Because I don't think most people would really understand that unless they're in production. This is used in many other organizations other than healthcare. In fact, healthcare is really just catching up to using a lot of these standard processes. But tell us about that training and what you learned and how you are actually using that methodology and that learning in this role that you have.
So the training was actually 2 weeks of training, and the process around the whole black belt, and we usually group Lean, Six Sigma, and together. So Lean being looking at the efficiencies in our system and removing the waste that are causing us to not work well and also to cause errors. So we're doing some work around that, and then Six Sigma is about decreasing those errors to the best possible rate we can achieve. So the difference in using these tools is that there's a standard process to making improvements, and I can give you a recent example. We just did an event around medication safety. Mm-hmm. So the process is to really look at our current state. So we look at what we're currently doing, and then we look at where we want to be. What's the ideal process that we want to put in place in order to keep our patients safe? And then by identifying those two things, we can look at our gaps and see specifically where our work needs to be.
Okay, so just using that, and let's start with, as you just mentioned, with medication errors. The new Institute of Medicine report called Preventing Medication Errors points out that the staggering numbers associated with preventable drug-related injuries per year is 400,000 injuries in hospitals, averaging more than one per day. So again, from your perspective as the consumer, as a patient in a hospital, you have medications that are ordered, the nurse comes in and gives you that medication. You assume that it is the right medication to the right person in the right dosage at the right time. Is that where the medication errors tend to be, that those things are not achieved, that there's been some error made?
The medication errors can actually occur in several places during the process. So when a patient comes into the hospital, we try and get what we call their home medication list. So it's very important for you as a patient to bring your medications to the hospital and your medication list so that we can continue to give you the medication that you are taking at home. So that's one place that it can occur. If we may not be continuing that process or giving you your correct medication. Another area that it can occur is in ordering of the medication. So now most hospitals have something in place called CPOE, or Physician Computerized Order Entry, where it eliminates the handwriting issues, it eliminates dosage issues, it's clear handwriting. So in the past there were a lot of errors associated with that, and that has decreased significantly because of those practices. Other areas where medication errors might occur are in patient identification. So getting the wrong patient, getting the wrong medication, and we do have technology in place to help with that also. But it's really also incumbent upon the patient to really know about their medications, ask questions, know what they're getting, know the side effects. So and then when you're going home, it's very important also to know what medications you're going home on and be very clear about what you should be taking at home. So that's another area that an error can occur. So it's important for you to be involved in that piece of it.
Well, let's take each of those one at a time. I think that Andy said that, if you come to a hospital, you want to come with your medications with you. Well, that sounds great, except sometimes you might be going to the hospital in an emergency situation or some circumstances such that you don't necessarily have them with you. So a good thing might be for you to know what your medications are by having them written down on a card that you have in your wallet, just like you have your credit cards or you have your Social Security card or your Medicare card or whatever cards you may carry. I think that might be a tip that you'd like to impart to people, because even if you don't have the medication, if you have the name of the drug, the dosage, the frequency that you are taking it, you could at least hand that card to your treatment team when you are admitted to a hospital, if that was the circumstance. So I think that at least gives everybody a jump start in knowing who you are and what you may need to have considered in your treatment. I think the second one was the order entry. That is a boon. Again, these are not the things that you're necessarily going to see in action when you are in a hospital, but it's very good to know that with new technology we've made huge improvements. Because years ago when I was a staff nurse, one of the hardest things would be to pick up a chart, read the doctor's orders, be able to read the handwriting and translate it accurately. Often that was not the case. You would often be talking to three other nurses. What do you think this says? And everybody be like, well, I don't know. What do you think it says? And then if you didn't have clairvoyance and be able to translate with 3 or 4 people as to what this really meant, then you would often be spending a lot of time trying to find the doctor so you could clarify it. That has been taken out of the equation because the physicians now are responsible for typing in their medication order, the dosage, the person, the timing, etc., and that goes directly to the pharmacy. So there are checks and balances, but it is not as time-consuming and error-filled as it was in the past. So I think we've really made a huge amount of progress in that, wouldn't you say?
Absolutely. We definitely have. A lot of errors have been avoided because of that technology. And I think that was a great tip you gave, to have a list of medications available in your wallet. And I would also recommend that you always keep that updated.
Right.
And make sure if you go to the physician's office that you update their list. Because as you know, you may have several physicians and several medications may be ordered by different physicians. So it's really up to you to keep that updated list and make sure all your other healthcare providers know that.
Right.
So
I think that's very important, because this is, again, a dialogue, and it's your responsibility in your own safekeeping to really have those conversations and be sure those checks and balances are occurring. I think the next point that you made had to do with the administration of the medication and being sure that the nurse is giving the right medication to the right person. Now, if you've been a patient recently in almost any hospital, you will notice that the nurse asks you over and over again for your name and your date of birth, because that person may have seen you for a couple days, or they may have seen you for several times that shift, and they do know that you are Tom Smith. But they have to ask that again because of all the activity that goes on, so many things that are happening. It's a very simple task, but you can get derailed, and it's easy to make an error. if you've got many, many other things on your mind and you know that you have got to finish your meds, this is the nurse speaking in her own mind or his mind. I've got to get the meds done, I've got to get my treatments done, I've got to do my charting, it's already 2 o'clock, I'm supposed to leave at 3. I mean, there's all kinds of things that people are thinking about. So that stopping and pausing and asking you one more time, as annoying as it may be, that is really a safety check.
So Nancy, earlier I talked about, Lean and Six Sigma and eliminating waste. So you need to know that one of the waste that we try and eliminate is redundancy. And so you might say, well, that's kind of redundant to keep asking my name. But that is actually one of what we call the necessary wastes. So it's one of those things that you should never be eliminated, one of those redundant steps that we will do over and over. So please be patient with us, because that is for your safety that we ask your name over and over and over. And if somebody fails to do it, don't forget to jump in there and say, oh, by the way, my name is, and here's my birth date.
Right.
So yeah, and that's how you can partner with us when to help keep yourself safe. Is that sometimes if we stray a little bit, just to jump in there and remind us, or to do those things.
And I think another tip to add to that, Andy, is that you have to get to know your medications. So when someone hands them to you, they should look familiar to you. You should look at those pills or capsules and just say, yes, that's what I'm used to taking. I recognize these. If for any reason you saw something that you didn't recognize, it's certainly your prerogative to ask the nurse to check on that. Is that been a change? I don't recognize this. I haven't taken it before, whatever. The nurse will stop and do that reconciliation to be sure that an error hasn't been made, earlier before she even brought it into you.
That's
that can
right.
happen too.
That can happen, and you should always be asking questions. So in the hospital environment, your prescriptions and your medication may not look exactly like it does when you get your prescription at home. So maybe your dosage at home is 1 pill, where in the hospital that same dosage might be 2 pills. So always ask and just clarify, is this, what are you giving me? And talk about it and learn about your medications. Always ask the question, let's go through this again. Because again, nursing, if you're not familiar with what you're getting or comfortable with it, and you've asked 3 nurses before you, just ask again. It doesn't matter. You should be familiar with your own medication and comfortable with what you're receiving and the side effects also.
That's right. So these are things that you can do to really help the process along. I mean, when you think about it, when you read the statistic, 400,000 major preventable errors with medication in a year. That's a lot of medication errors, but the volume of medications that are administered in hospitals is in the multi-millions. So it is still a small percentage, but it's a lot of medication errors. Not every error is life-threatening, but every error has to be recorded. So that's part of the statistics.
Yes.
No matter if it was a small error or a large error. Certainly large errors can be lethal, but we want to catch every tiny error as well, because we don't want to have the large errors. I mean, everything in hospital operations, which is what Andy is doing and really, spending her whole day on, is really helping the nurses and the whole treatment team to improve their operations so they are error-free. That is the whole goal. And this whole thing about patient identification is one of the reasons there are so many errors. Of all the reasons, patient identification was a leading reason. So that asking, again, just to drill that in, is the reason we're doing that. So, do you think that in the future there are going to be some ways that we can eliminate even more errors? I've been thinking like maybe there'll be a technology where the nurse doesn't have to ask the patient's identification, because somehow it'll be scanned in some way where we'll know for certain that that's the person. But we don't have that now.
We don't have that now. We do have some good technologies that we do use in terms of scanning. So for medication safety, we currently use, we scan a patient's bracelet and we scan the medication to match them. So that's like the double check that Nancy talked about earlier. But then, nursing still asks the patient to identify themselves. So we have other technology that we use to eliminate some errors. To eliminate errors around labeling for our lab specimens is also barcoding. So it's identifying the patient through scanning their bracelet and then verifying that that's them. And what that allows us to do, Nancy, is to give a patient label for that blood specimen for just that patient for just that lab.
Right.
So that kind of that takes the process down to just be about that patient and eliminates a lot of the various processes involved in labeling a specimen.
I think what this boils down to is anything we're extracting from you, your blood, your urine, tissue samples, we want to be absolutely certain it came from you, because a lot of these things are then used for diagnoses. So we don't want to mix up a tissue sample, for instance, and find out that a person who was diagnosed with breast disease, for instance, was the wrong person, because then that really creates a whole downstream set of problems because it was really not captured early on. So anything we take from you or anything we give to you, blood, medication, IVs, we want to be absolutely certain it's going to the right person.
Right. And then other benefits from it are also time. So if we were to identify that there was an error, we'd have to stop the process, redraw it, and you wouldn't want to get restuck again. And then rerun the process. So this barcoding technology has helped to eliminate a lot of waste up front also.
Right. So part of what you're hearing about in terms of the cost of healthcare, these technologies are very expensive, but they do pay off because, as Andy just said, less errors means we're in a better quality situation. But hospitals have had to make huge investments to really get to this point. So in terms of prevention of medication error, the last part was what we talk about in the biz is medication reconciliation when you go home. So would you translate that for people about reconciliation of their medications?
Okay, so medication reconciliation is actually a process that starts when you come into the hospital all the way to when you go home. So like I mentioned earlier, so we want to get that list of medication you take at home, and we want to make sure that you're getting what you need in the hospital. And then when you go home, that you're given information that tells you clearly what to take when you go home. So if you've ever been a patient, you might have been told, stop this medication, now take this one, for example, or we're going to continue to take this one, but we're going to change the dose. And we want to make sure you get that information clear, so when you go home, there's no confusion. Okay, what do I do now? So that's the reconciliation piece, is to give you good information when you leave the hospital so that you can continue to take the right medications. And
well, I think that can be very confusing for people. Do you have any tips? Because people then wind up with so many medications. It's hard for them to say, okay, these were the old medications, now these are my new medications. Maybe I should save the old medications because they cost me so much money.
Yes.
I don't want to just throw them away. How do people manage all this? This is not easy to manage.
One of the ways you can manage it, well, two ways. So before you leave the hospital, make sure that you understand your discharge instructions. Go through them. If you have questions, make sure you ask questions. Make sure that you understand the list of medications that you've been given before you leave. So as Nancy mentioned too, when medications get changed, it can be an expense. But you have to understand that really it's probably an expense that you kind of need to just move on and take the appropriate medications. Because I know that that's difficult because people don't want to just, well, I paid good money for these, and so I don't want to take them anymore, and then I have to buy new ones. So it really is important for your health and your safety to take the medications that were prescribed.
Very good. Well, let's talk about falls, because now I think we've got the medications licked, but falls really can be even worse to manage than medications. So Falls really can happen at home. They can happen when you're outside, but when they happen in hospitals, they can have even worse consequences because often people are medicated, they're in beds, they're trying to get out, maybe to go to the bathroom, they're trying to climb over the rails, which is really supposed to be there to contain you, but people get confused. It's all over the map. So one of the jobs that Andy has is the very complicated job of helping all the nurses primarily, but all the staff in general, and patients and families understand fall prevention. So give us the short version of fall prevention.
So one of the things, like Nancy said, falls do occur in the hospital, and a lot of times it occurs because it's a very unfamiliar environment for people. Mm-hmm. Think about at home, you're very familiar with your own home, and so you can navigate that easily, but at home, in the hospital, it's very different. You're not familiar with where to go to the bathroom. Like Nancy said, you have side rails and different things that are actually going to be barriers. Sometimes you might forget that you have an IV or you have other devices that you're attached to. So that's the piece, is just to be aware of really what is going on around you and always ask for help. And some of the other things that we've done is to standardize the processes around what nurses and techs do when a patient is identified to be at risk for falling. So it all starts there. We do an assessment to identify if a patient is at risk for falling, and then put specific things in place to keep you from falling. So you might see yourself have a bracelet or some form of a visual cue or something that lets everybody know this patient's at risk for falling, so they should be helped to the bathroom, they should be reminded to call for help. The other things are, again, we do that assessment frequently and change the interventions as we need it. Another important piece is to involve your family, to say to them, they tell me I'm a fall risk. Remind me if I start to get out of bed and forget. Mm-hmm. And as Nancy mentioned, that's an important when, say you're getting medication and you may not be used to it. So you might, if you're getting pain medication, you might find that you're a little bit more dizzy, a little groggy. So to enlist the help of a family member or a friend to remind you, I think is also very helpful.
I think one of the major reasons people get caught in this whole unfamiliar environment, which is a very, very important part, is really bathroom travel, from bed to bathroom. And so the nurses really understand this, and they want you to alert them. And they are actually doing rounding more frequently in order to ask people if they need to use the bathroom, so that they can anticipate that and therefore not wind up in a situation where you're urgently needing to go to the bathroom. You're trying to get the call system to work for the nurse, but the nurse is tied up for that period of time. So try to anticipate all that, so it's not really a last minute thing where you're rushing in order to, really make that. Falls really, especially with the elderly in hospitals, can be extremely dangerous, and that's why so much emphasis is put on all of this checking. So I think that what we're saying in these two examples, there are many other examples, but I think that Andy wanted really to educate you on the falls and the medication management, because this is really where you can team up with your treatment team in the hospital. The family, friends that are visiting, you, the patient, as aware as you possibly can be. These are risks, and these are risks that you can play a part in trying to prevent as well. It's not just the nursing staff trying to anticipate everything. You can anticipate, and you can raise your hand or ring the call bell or just say, I really like to know that I could go to the bathroom every hour. This has been a problem for me even at home. I know that I really should plan to do that here. Please don't be shy. Tell us about one closing comment that you could really, advice that you would give our audience in terms of how they could really make sure that neither of these things really happen. We've given them a lot of tips already, but you're right on top of this, Andy.
So one of the phrases that we like to use, and I think that this is a good phrase for our patients, is to speak up for your own safety. Okay, be involved. ask questions, know what, before you come into the hospital, be prepared, and don't be afraid to, like Nancy said, ask for help. That's what we're there for. You're in a different environment, and you need to help speak up for yourself. And if you're in a position where that might be a little bit difficult because of your treatment, enlist a family member, have an advocate, somebody there to help you through it. So it's always good to have company, right?
That's it. So it's a team, and we really want you to be a part of that team. And I think Andy has helped us today very much to understand your role and stake in safety within the hospital framework. Thank you so much for being with us, and join us again soon. Have a wonderful day. I hope you enjoyed our conversation today and that the information will help you in meeting your health goals. Catch this program and other conversations on the website, drnancyrn.com. Or you can write to me as well. I welcome your comments and feedback. Thank you for listening, and join us again. And remember, with health, all things are possible.